Hello, I'm Dr. Malik. I'm a psychiatrist with experience in both old adults and general adult psychiatry. This is the Oxford Psychiatry Group. Welcome, and this is
Dr. Michelle. I'm a consultant in old age psychiatry.
Welcome to this session on when memory problems become a concern. And because this is Dr. Michelle's specialty, I'll ask you, Michelle, in your experience, when do memory problems become a concern? Or when should I be concerned if I walk into a room and forget why I came into the room? Is that worrying? And if I lose my car keys or phone, is that worrying?
Does it happen this week, Matt?
That happens all the time, Michelle. What does that mean?
So I think that's a really good question. I think that's why often people seek help. They're not quite sure what's the difference between normal ageing and when it's more than normal ageing, such as dementia. So what we find is, all of us do that every day, don't we? So maybe we lose our keys or forgot where we've parked. I suppose the difference is when it comes worrying is it affecting your day-to-day life? Are your family worried? So often we find that if you've got a bit of a memory problem, you might not necessarily notice it yourself, but your family are very concerned about you. You've noticed lots of changes. Maybe your personality's changed a little bit. Maybe you're a bit more irritable. So I think when other people are worried, when it's affecting your day-to-day life, and I think there's certain things as well that a little bit of forgetting is normal, but say you forget someone's name of a close family member, so you might not remember someone's name that you've met once, but forgetting a granddaughter's name or a daughter's name, that's a bit more of a worry, Max.
Okay, thank you. That's a good summary. So, lots of people know about this word dementia, and it's kind of a scary word.
Yeah.
And we know that we have an ever increasing population with this diagnosis. But what I'd like to ask you is, in your specialist opinion and knowledge, are there other, for example, conditions or reasons why people might have a harder time remembering things other than just dementia? And we'll come back to dementia,
Okay.
but what do you think? Are there other things that can affect people's memory?
We certainly see a lot of that in the memory service, Max. So, for example, we often get referrals for ladies maybe in their 50s, late 40s, early 50s, when actually it's beginning of menopause, but they're suffering from brain fog and they're referred to a memory service, so that's pretty common. Physical health conditions, so for example, sleep apnea. So with that, you're not breathing properly, so your brain's not getting enough oxygen. And often people feel a bit foggy in the morning, a bit of low energy. Again, commonly presents to memory clinic. So lots of physical health conditions. Lots of medications as well we know have an impact on memory, and probably quite common medications that we wouldn't necessarily associate with having a memory problem. So for example, PPIs, so indigestion medications, statins, they can all impact on cognition. So it becomes really complicated, Max. We know from our personal experience to try and unpick what might be going on.
Yeah.
So what we know is that common medications such as PPIs, protein pump inhibitors, which GPs commonly prescribe for indigestion, they're now associated with memory problems.
That's really interesting, and that medicines are really important as well. And what I've noticed is a lot of people might say, "Oh, I'm losing my mind, doctor," but that often isn't dementia. People say things like that. It's more anxiety,
Yes.
could be stress,
Yeah.
could be sometimes mood, depression and things. So lots of things impact on memory. And that's why we have specialist memory clinics and specialists like you, Michelle, who do differentiate between these things. If someone is feeling a bit anxious or depressed and they've been through a difficult time and they do forget things or have difficulty remembering new things, let's say, how would you explain that or differentiate that from dementia, let's say?
That's a very good question. So often people need a bit of time. So say people have had a big stress, they've been in hospital, maybe they've lost a loved one. It can take a bit of time to readjust. So from my point of view, just giving them a bit of time to allow people to settle and manage their anxiety is very important rather than rushing into anything. And then if it's still an issue, I'd say a really, really careful history, Max. So as we know from our job, it's not necessarily all about scans or blood tests. It's just a really clear history. And often that gives you a flavour of what's going on.